In general, have nurses shown you compassion?
I would say yes. I've had a lot of surgeries in the past, and I feel like they've been very compassionate.
What kind of surgeries have you had?
When I was in 8th grade, which was my scariest one, I had my left ovary and tube taken out because I had bad cysts on them. I've had back surgery. I've had several miscarriages, and I also have had a hysterectomy.
Has there ever been a time when a nurse hasn't shown you compassion?
I can just remember one time trying to get prepared for surgery, and I have bad veins, and they were trying to put an IV in my hand, and she kept jabbing me, and I was really upset by it, but she didn't really seem to care, and I have to say from that point on, I've been really scared to get an IV.
And since that nurse wasn't compassionate towards you, has it changed your view of nurses?
It hasn't changed my view of nurses now, because I've come into contact with so many compassionate ones.
Okay, thank you.
Do you feel like your patients perceive you as compassionate?
In general, I'd say they do. I try to make a point of listening closely to their concerns, letting them know what to expect from the day, what to expect from me. And a lot of them tell me that I'm compassionate. On the other hand, if I'm stressed out by too many tasks that need to be completed at once, I know it shows. And so then I think sometimes they may feel a little coldness or distance, and it's just, the stress of work showing through. But generally, yeah, I'd say they consider me compassionate.
Are your coworkers compassionate towards their patients?
Speaking generally, yes. I'd say when they're interacting with the patients, they're very compassionate. We vent to each other, but everyone has to do that. No, generally speaking, I'd say almost all of us genuinely care about how our people are doing.
And having been compassionate benefited you in your career?
Yeah. I mean, I don't care about my patients, and I don't sincerely have compassion for them because it will advance my career. But patients perceive when you care about them, and when you care about your patients doing a good job, being thorough, making sure everything you're doing is safe, all of that reflects on you and makes you a good performer. Your patients know it when they get their surveys back. It's reflected there. So yeah, I think when you're compassionate, you really care. First of all your care will be better because you're making sure they're safe. You're listening to their concerns. You're passing on their concerns if you need to. And I lost my train of thought. Hold on. I stayed up all night making an apple pie.
Oh, awesome.
That's okay. Hold on. Oh, so what I was going to say was, when you're compassionate, it makes you provide better care, generally speaking, especially safety. That's so important to me because I care about them, making sure their orders are right, making sure, I'm just staying on top of everything with them. And then, in turn, your coworkers and your boss, they all know that you're doing a good job. It shows. I think just the compassion goes through into other areas of your care. Okay?
Awesome.
Do you feel like your patients perceived you as a compassionate nurse?
Yes, I do.
And why do you think that?
Because they were always happy to see me, and they always had a smile on their face when they saw me coming, and they always told me what a good nurse I was, and I'm just a compassionate type person.
Okay, so do you think that your coworkers were compassionate toward their patients?
Not all of them, but for the most part, most of them were.
And those that weren't compassionate toward their patients, why do you feel that they weren't compassionate?
I think that they were just in the nursing field for the money. And I think that if you go into nursing for the money, that's for the wrong reason. I think that you should always go into any field that you choose to go in for the right reason. And I feel like I went into it because I was meant to be a nurse.
So do you think that your coworkers were sincere?
Not all of them.
And how so? Like, how do you think they weren't sincere, those that weren't?
Well, I worked with one nurse that every night, well, when I was working second shift at a facility, if the patients had any type of drugs, any type of pain medications or sleeping medications, she would always make sure that she gave those medications to the patients. And I can remember her going out to take a break, and she made the comment that that was her kind of patient, a comatose patient. And to me, that was not a good nurse.
Definitely not. That definitely shows that they were only there for the money, that they didn't really care about the patients. So do you think that being compassionate benefited your career?
Absolutely.
And how so?
When a person is sick, they need somebody that's compassionate and somebody that can sympathize with them. And you don't need somebody that's going to be mean to you or rude or mistreat you in any way.
So in other words, they need a friend.
They need a friend.
They need a friend, not just a nurse.
Exactly. And I always tried to go above and beyond with my patients, and they always appreciated it. And I still have people that come up to me. There's a lady in Hartsville. She's a Walmart greeter now, and I took care of her after she had had a heart catheterization done, and she developed a blood clot, and that was years ago, but she still remembers me because I took care of her. So
Yeah, so they'll always remember you.
absolutely.
All right, well, that is all. Thank you very much.
You're welcome.
Has there ever been a time when a nurse has shown you compassion?
I recently had surgery on my arm, and the nurses were very caring and helpful.
Has there ever been any negative occurrences where they were not compassionate?
No, nurses have always been helpful to me.
Other than your surgery, have you ever had any good interactions with nurses that were compassionate to you?
I've never had any other interactions, but nurses have always been very good to me.